Reid, thank you so much for being here today.
Really excited to be here. Thank you for having me.
Of course. So let's dive in. Talk to me about exactly what your company does.
Yeah, so Veradermics is a medical dermatology company, and really the origin of the company was the idea that there are more than 3,000 skin conditions, many of which have no FDA-approved treatment, have had minimal innovation in decades, and there's minimal innovation in the horizon. And so we set out with the mindset that we could leverage our end-user knowledge as physicians to identify treatments that address real therapeutic challenges within dermatology.
Very cool. So who's your demographic that you're looking for here?
So we have 5 products. The lead products are for pattern hair loss, also known as androgenetic alopecia, and then for common warts, which, as their name suggests, are common. And for each of those, it's right, individuals affected by these conditions who are looking for better treatment.
So because I'm not a technical or a science or a healthcare person, can you explain to me, like I'm 10 years old, how each of them works to target those conditions?
Yeah, so within the bounds of confidentiality, I can tell you, kind of the high level there. So for pattern hair loss, the idea, right, that's baldness that we see affects 80 million people, 50 million men, 30 million women, most common type of hair loss. And essentially what happens is that over time, the thick scalp hairs that we all possess, early in life start to thin and then eventually go away. We are developing an oral therapeutic that is non-hormonal, which is very important to us, that we believe has great scientific validation that with once daily administration can assist with hair regrowth and hair stabilization.
Excellent. And talk to me about the wart one as well.
Yeah, so the wart product is really fascinating. The wart product is essentially a Band-Aid that has little dissolvable protrusions that come off it. And each of those protrusions, or what we call a dissolvable microarray, contains an immune stimulant. And you apply it to the wart in a process that is virtually painless, like applying a Band-Aid, feels a little bit like pressure. And in doing so, these little protrusions dissolve in the skin, kind of like icicles melting, releasing these immune stimulants. And what we see happen is that the immune system then gets revved up in the area so that it can recognize and fight off the human papillomavirus, which causes warts, leading to wart resolution. And that therapeutic is currently in a phase 2 study, so we're very excited, anxiously awaiting results there.
Oh, that's so cool. It'd be great to have something as easy as a Band-Aid for that.
Absolutely. Applied once every 3 weeks. So we think about the remainder of the therapeutic landscape. Right, there's freezing with liquid nitrogen, fairly painful, and when we think about young children who are disproportionately affected by warts, they simply can't tolerate it. Or salicylic acid, which is what's in brands like Compound W, has to be applied every day for weeks at a time, and efficacy is still modest with both of these treatments. So we're very excited to hopefully bring something new.
Excellent. Now, was there something personal about starting this company for you, or what was your founding story?
So the founding story is probably sillier than anything, which is that I was at an American Academy of Dermatology meeting, and I got nominated to attend this pre-meeting for Advancing Innovation in Dermatology, which is an organization that promotes physician entrepreneurs and physician innovators and really tries to take researchers and have them build real products. And so I attended this conference primarily, I think, because it got me out of a day of work at the time, and I was very excited about that. And at the conference, I heard about a variety of events, and one of them was an event that they no longer do, unfortunately, called Hacking Dermatology. And I met my co-founder there, and the origin of the company was that basically we're having breakfast. He says to me, what if we could administer an immune stimulant with what is essentially a Band-Aid? I was like, that's a great idea. Croissant falls out of my mouth. And yeah, now it's 4 years later. We have 5 products. And we have that product in the clinic, another product that's about to start dosing patients. Really exciting time for the business.
Very cool. And what were you doing before?
So I'm a board certified dermatologist by background. Yeah, so I always saw myself as someone who would treat warts on a daily basis, but not necessarily someone who would develop a treatment for warts. So it's very exciting. I think a lot of the research element, though, came naturally because in my clinical career, I performed quite a bit of clinical research. So serving as an investigator on industry trials, phase 2, phase 3 studies, published a lot of articles, actually wrote a textbook, which was pretty exciting. So all of that translated to really the pharma landscape well.
What was it like to go from the clinical side to the business side and being an entrepreneur?
So I tell people that I think if I had to pick like what career probably fit me the best, I would be a like private equity type person. And I think that the reason I went to medical school is that I was in high school during the Great Recession in an area in Kansas that was particularly hard hit. And my father's a physician. And I saw how he wasn't worried about losing his job. There was a lot of stability in our household, whereas in the community around me, there was a lot of turmoil. And so I immediately gravitated towards stability. I think my natural skill set and fit is certainly as a finance person.
Now, talking about finance, tell me about your funding journey. Was it hard to convince investors to take a chance on you, and how much have you raised so far?
So we've raised nearly $40 million, and I think we've been incredibly fortunate in that identifying many of our critical investors has occurred very serendipitously, not necessarily through these intentional approaches that we all employ to raise capital, but just during day-to-day interactions. And the original roughly $2 million we raised all came from physicians. So more than 25 physicians, they said, hey, we recognize that warts are a problem. We recognize that these other dermatologic conditions need treatment. And they believed in the team and investing in us. And that support then translated into more of a traditional venture round. I think people saw that we weren't paying our KOLs, they were investing in us, and that was really an exciting and different journey for most of the investors. We were then fortunate to get the backing of Dr. Vlad Korich, who is the CEO of Biohaven, and John Childs, who's the managing director of JW Childs Associates.
What does fundraising afford your company?
So the $40 million has allowed us to take many of these early stage assets, either advance them into clinic, 2 of them are now clinical stage, a third should be a clinical stage asset before the end of the year, or do additional preclinical characterization. So, right, all of these are heavily regulated products. So each of them must go through the gambit of testing to ensure that they're safe, right? Whether that's non-clinical toxicology, or what people often call animal research, or whether that is characterization to say that the substance that you think you're making in the lab is in fact what you're making. And so a lot of work has gone there. Current money is meant to get us through 2, hopefully, proof of concept generating readouts for the Wart program and the hair loss program.
Interesting. Now I know you said you're still pre-revenue, you haven't exactly gone to market yet. Can you describe any metrics that show the scale of your company as it is right now?
Yeah, so the biotech industry in general is all about competitive advantage that comes with the regulatory landscape. Because for anyone to be an entrant, you have to go through this long process of testing. And so when we think about future value, or when investors try to value the company, they look at revenue projections. And we've had third-party commercial assessments, for example, for the pattern hair loss program, where in the US alone, we believe that to be a $1.5 to $1.8 billion a year market. The reason being, again, 80 million people, right? More than 12 million are currently seeking treatment for their hair loss, and there's no approved oral options in women. Oral option in men can cause erectile dysfunction, can cause mood changes, and the topical options are messy. They don't meet what people are looking for.
Interesting. So you're based in West Hartford, Connecticut. Not typically what one would consider an innovation hub like a San Francisco or a New York or a Boston. Why did you choose to base the company there, and has it been beneficial for you?
So the state of the Connecticut, or Connecticut Innovations, which is the state's venture arm, has done more for the company than I could have ever imagined. Not only do they hold a roughly $6 million position in Veradermics, but they provided us with numerous resources, whether that be a talent acquisition specialist, whether that be PR assistants. I mean, they have been tremendous. They've helped us grow our network. And I think that you will see Connecticut become a biotech hub as people want to move out of the cities. They want to move to places that are less expensive. Connecticut sits right in the middle between New York and Boston. So we have great talent pools to pick from. And with this growing life science center and success stories like Biohaven, like Arvinas, I think you're going to see that there's a substantial growth in the biotech industry in the state.
Well, I love that. As someone from Connecticut, I'm very glad to hear it. So switching gears a bit, what would it take for you to sell your company, and is that your goal?
So that's a very complicated question because, as you mentioned, we're a pre-revenue company and we, incur significant development expenses, right? Clinical trials are extremely expensive. The clinical development process is extremely expensive. And so there is substantial capital that has to be raised now in between, approval for a product. And currently we're a privately held company. Company raises from private investors, venture investors, crossover investor, that type of investor we seek. Eventually the company's capital needs would be so great we would require a transition to the public markets. So one option would be to go public, continue to finance the company that way, take these products to commercialization, become a revenue generating company. The other option, as you mentioned, would be sale of the company, sale of the asset, or partnership. Each of these can be done in a combination, and the exact pathway that the company pursues will depend on market conditions, will depend on future investor mix, and will depend on continued success of the development of the products.
Do you have any goals or dreams or what you would like to see happen with the company?
I would like to see us develop these therapeutics, get these products approved, and get them in the hands of the people who need them.
That's amazing. Now, a little bit of a fun one for you. If you could travel back in time, and if you could tell yourself one piece of advice the day before you started your company, what would you say?
Ooh, that is a good question. I think that the answer to that is likely not everybody gives good advice. So I've been very fortunate. We have some tremendous thought partners. I've got to work with some of the leading minds in the industry, people who have been very generous with their time to help in my growth, to mentor me and to mentor the company. But it is interesting because as you move through each phase of the company, the thought leaders or the thought partners that you need are very, very different. And I don't think I appreciated how someone who is really savvy at the seed stage may not necessarily understand the Series B or crossover stage, and then may not necessarily understand what does it take to take a company public. And having the right people at the right time to assist you is just critical.
How do you find the right mentors?
So I'm a very chatty individual, and I love to talk to people, and I firmly believe that most people, if you ask them, are very willing to be helpful. And I think we can get people excited about the mission, excited about what we're doing. And we've been very fortunate that through working our network and through cold outreach, we've been able to get great people on board.
Awesome. Is there one business rule that you operate by no matter what?
So I think that one of the things I read, you read all these things and you go, is that a good idea? Is that a bad idea? But one thing I read that I find to be very true, and I try to take into work every day, especially considering I'm not necessarily a technical expert in every aspect of our business, is that I approach all our interactions as though the other person has a piece of information that I don't know that I need to get. And there are lots of times where I think it's easier to tell people, and not ask. And everyone in the room is sitting there, they know something you don't know, or they're thinking something, they're all thinking the same thing when you walk out of the room. And so I try to approach everything with a lot of questions. I think my team would say that every interaction with me is 20 questions, but I found that to be super effective. I feel like I've learned a lot, and I feel like I often walk out of a room with a very different outcome than I anticipated.
It's also hard when you're such a young founder, and I feel like a lot of the people in the under 30 community that I talk to have like serious imposter syndrome because they're so young. Have you ever felt that, and has being young been an advantage for you or a disadvantage?
So I think it's funny because I don't think anyone has any idea how old I am. Between the beard and then sometimes I wear glasses, I think it's very confusing. And one of the things that I think has been different is that I went to medical school very young. So I did a combined BA/MD program at the University of Missouri, Kansas City. So out of high school at age 17, I went 6 years, got my BA and MD in that 6-year period, graduated med school at 23, then went and did a residency, finished that when I was 27. And so I had a lot of life experience. I'm 29 years old, but I've had a lot of life experience and a lot of working in complex team environments that I think has made it easier to relate to, the seasoned pharmaceutical executive board members or thought partners or employees who have had really tremendous journeys working on, major approved products.
Very cool. Now, what's next for you in 2024? Where do you see your company going? Any exciting announcements you can share?
So 2024 is going to be, I'm hopeful, our most exciting year yet, right? The goal is always more excitement. And 2024 will be a year where hopefully we will move one product, the pattern hair loss product, into a potentially registrational study that we will advance the Wart product through the end of its phase 2 program, hopefully, and the remainder of the clinic, or remainder of the products into the clinic. Clinical development has certainly timeline variation, but the ultimate goal is to start testing everything, start getting everything a step closer to approval.
Excellent. And one last question for you, Reid. What would you like your legacy to be?
That's a very difficult question.
I know.
And I think at the end of the day, most of what we are doing is about building product and is about building something that has actual value to the people who use it. And I would hope that, for example, we have this novel antiviral that's for molluscum, that those products would become synonymous with the conditions and would really take away these therapeutic challenges that we're trying to address.
Well, that is a great answer. Thank you so much.
Thank you so much for having me. This was tremendous.